If you suffer from red, irritated, itchy eyelids, missing eyelashes, tearing, burning, red eyes, or even notice flakes or crusting on your eyelids, you may have blepharitis. In today's video, I'll go over some of the home remedies for blepharitis I recommend in my clinic. Welcome to Eye School with Dr. D, where my goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every week. Welcome to Eye School. I'm your host, Dr. D. The theme of Eye School is lifelong eye education, so I always invite you to let me know what you're learning and request videos about new topics. If you find this video informative, consider hitting the thumbs up because it helps YouTube know that this video is helpful. All right, Eye School pupils, let's take a look at today's topic, blepharitis and some easy at-home remedies to help get your inflamed eyelid margins under control. So when I started practicing 12 years ago, eye doctors were widely recommending cleansing your eyelids with a mix of baby shampoo and water. Luckily, we've come a long way since then, and now we have many more options for our patients to control their blepharitis at home. Now, I've made an entire video about blepharitis and you guys loved that video, so I'm going to link it up above so you can always reference that video as well. But I'll go over blepharitis in today's video as well, so you don't have to leave this video to watch that one first. So generally speaking, blepharitis is an inflammation of the eyelid and eyelid margin. There are two recognized types of blepharitis defined by where they occur. So anterior blepharitis is on the anterior or more exterior aspect of the lids. Anterior meaning, more forward, posterior would be more back. Anterior blepharitis is commonly seen as flakes or cuffs of debris on the lashes or on the lid margin. You might also notice redness, puffiness, or tenderness of your lid when you touch it. When dead skin cells accumulate on the lid margin, bacterial overpopulation can occur, and this can lead to inflammation and irritation of those lids. Now contrast that with the other type of blepharitis, which is posterior blepharitis. Posterior blepharitis refers to inflammation and disease of the meibomian glands. Meibomian glands change over time, but they can also be affected by our environment. And typically in posterior blepharitis, we are seeing a thickening of the meibomian glands and atrophy of the meibomian glands. I have talked about blepharitis and meibomian glands at length, so I'm going to link out another video here about Demodex where I have a big discussion about blepharitis in that video as well. So let's get into the goal of your at-home treatment. So anytime you have this accumulation of debris, these issues with your meibomian glands, you're wanting to manage the biofilm. The goal of treatment is manage the biofilm, manage the bacterial overpopulation that's happening at the lids. We also want to loosen the thick glands, change that oil from being so thick into a thinner, more fluid oil that can come out and coat our tears as it's supposed to. And finally, we want to kill any Demodex mites that might be living on our lash margin. All right, so without further ado, let's get into our at-home remedies. The first step in at-home remedies are lid scrubs. Lid scrubs are a much better alternative to baby shampoo and water. You can get these in pre-moistened wipes like is shown in this box right here, but you can also get them in like a foaming cleanser. My favorite types are OcuSoft. Optase makes a wonderful wipe with a really, really soft feel to the cloth, and that's really nice on the eyelids for cleaning away debris, reducing the biofilm, and calming that inflammation. I made an entire video about Optase up above, and I will link that here. Optase wipes, OcuSoft wipes, they work well on both anterior and posterior blepharitis. However, you do want to use caution when talking about tea tree oil. So some of these wipes will include tea tree oil, and I made a video on that I'll link above. But tea tree oil can actually be harmful to your meibomian glands. It's a double-edged sword, right? Because it's helping kill the Demodex mites, but yet it can have that negative impact on the meibomian glands. So you definitely want to use that sparingly and under the care of a doctor. Finally, you can check out okra-based polysaccharides, which the commercial product for that is Zocular. I actually made a video on Zocular as well. If I still have links to use, I'll throw it up above, but that's a really great alternative. It is anti-inflammatory. It makes the lids feel better and be less inflamed, and also helps manage that bacterial population on the lid margin. So some examples, at-home lid scrubs, you should be doing these daily, in the morning, at night, or even both if your blepharitis is more severe. Some brands I like: Ocusoft, Optase, Mediviz, and Zocular, and I will make sure to link those down below. The second type are lid cleansing gels. So this is the same exact concept as above, but without a pre-moistened wipe. And most of the kinds that I talked about up above also come in a gel or pumping sort of cleanser form. For these, the method is important. You definitely want to get right to the base of the lashes where the Demodex and the dead skin cells and bacteria are accumulating. I want you to think about a forest. We're not trying to clean the tree tops. We're trying to clean at the base of the trees on the forest floor where the leaves and the needles accumulate. So get all the way down to the base of the trunks, which means on your lid margin, all the way down to the base of the lashes where they meet your eyelid. All right, another type of at-home remedy are lid sprays, and I really like lid sprays that are hypochlorous acid. So hypochlorous acid in eye care has been used for several years now, and it can provide effective relief from dry eyes and even getting like styes and lid infections. It's a treatment option for red, itchy eyelids associated with conditions like blepharitis, meibomian gland dysfunction, and lid hygiene products that contain hypochlorous acid are a great addition to your daily routine. You can even do these in conjunction with lid scrubs or lid gels that we just talked about to decrease the microbial load on your lids and your lashes. You simply spray these on the lid margin. I made an entire video about your nighttime dry eye routine. I'll link that either above or down in the description, depending on how many links I have left. And you can check that out there. So typically using hypochlorous acid spray before you use your artificial tears the last time for the day. Our next method of treating blepharitis at home would be with a warm compress. I've made an entire video about warm compresses as well. I'll link that probably down below. I think we're out of links. So for patients with meibomian gland dysfunction, warm compresses are a great therapy that helps promote secretions basically of the meibomian glands. In meibomian gland dysfunction, we have thickened lids, thickened glands, and doing a warm compress will help loosen up those glands and provide a better oily layer for your tears. I'll throw this one in. This is a bonus. I didn't have it in my original notes, but taking an omega-3 fish oil, high quality, pharmaceutical grade, triglyceride form so your body can use it effectively, is very, very helpful in dry eye. It's not the kind of therapy that will give you overnight results, but it's the kind of thing that in conjunction with all of your other at-home therapies can really make an impact. It's anti-inflammatory and has been shown to help with the signs and symptoms of dry eye. And finally, there is an at-home device. It is FDA approved and it's called the New Lids System from New Sight Medical. It's a handheld device that was recently approved by the FDA. It's an at-home treatment for meibomian gland dysfunction, and they kind of use the analogy of an electric toothbrush. So it's used at home between your deep cleanings and regular visits at your eye doctor. So if you watch my last blepharitis video, I talked about microblepher exfoliation. That's your in-office deep cleansing of your eyelid. Another one would be tear care. Also have made a video about that. Tear care is a deep cleansing of those meibomian glands. We're heating the glands, we're expressing the oil out. But New Lids is a really great alternative that you can use at home, and it is FDA approved to help with your meibomian gland dysfunction. So according to their website, New Lids is used for 60 seconds a day, 15 seconds per eyelid to gently and methodically massage the lids. It removes collarettes and decaps blocked meibomian glands, allowing the meibum or the oil to run clear. The result is decreased tear evaporation, a reduced dependence on artificial tears, and fewer symptoms and signs of dry eye disease. This device is prescribed and purchased through an eye care professional, and I think it runs around $300. It does have disposable tips that are an extra fee. So ultimately, at-home treatments can really make an impact on your blepharitis and reduce symptoms greatly. It goes back to when you have dry eye, your habits and what you do day in and day out can really make an impact on how your eyes feel. For completeness, I want to go over a couple of the in-office treatments your doctor might mention, one of which is IPL. I did a video on that as well, intense pulse light. In my clinic, we perform IPL for dry eye. It is FDA approved now as of very, very recently in 2021. There's also low-level light therapy. You might hear of radio frequency, which is used on thick meibomian gland secretions to thin them out. You may hear things like gland expression, lipoflow is a type of gland expression, tear care. I've done a video on that. That's what I do in my clinic, Mibaflow, and even iLux. For your anterior blepharitis, microblepher exfoliation is very common. That's a deep cleansing of the eyelids, and there's even an in-office version of the Zocular products called Zest. That's a treatment that we can perform in the clinic to reduce your bacterial load, reduce your inflammation, and make your eyes feel better. I hope you enjoyed that recap of blepharitis and some of the at-home therapies you can do. Make sure to let me know down below what therapies you've tried and your favorite at-home blepharitis therapies. That is it for today's lesson. I hope you enjoyed it and learned something. Remember, learning is lifelong, so make sure to stay tuned in the future by subscribing. I continually update my videos as my understanding evolves, and I wouldn't want you to miss a thing. I'll see you next time.